Here's a question I want you to sit with for a second. What is the difference between Medicare and Medicaid? Not the vague one is for old people and one is for poor people answer. The actual difference. Which one do you qualify for? What does each one actually cover? What happens when you're on one, or both, or neither? If you couldn't answer that confidently, you are in very good company. Medicare and Medicaid are two of the most important and most misunderstood programs in the United States. And for disabled people, the stakes of understanding them or not are enormous. We're talking about whether you get the medication you need, whether a hospital stay bankrupts you, whether the home care you depend on gets paid for. I'm Drew. This is Disability.co. Let's clear this up once and for all. Let's start with the foundation, because this is where the confusion begins. Medicare and Medicaid sound similar. They both start with Medi. They're both government health programs. They both cover medical care. But they are fundamentally different programs with different eligibility rules, different funding structures, and different coverage profiles. Medicare is a federal health insurance program administered by the Centers for Medicare and Medicaid Services. Medicare is an earned benefit, similar to Social Security. You qualify for it based on your age or your disability status, not your income. Crucially, there are no income or asset limits for Medicare. A millionaire and someone living below the poverty line can both be on Medicare if they meet the eligibility criteria. Medicaid is a joint federal-state program. The federal government sets baseline rules and provides significant funding. Each state administers its own version, sets eligibility rules within federal guidelines, and determines what services it will cover. Medicaid is needs-based. Income and assets matter. It is designed for people with limited financial resources who need health coverage, and that includes many disabled people who may not have significant work histories. The critical implication of that state variation: Medicaid in California is a very different program than Medicaid in Texas. Benefits, eligibility thresholds, covered services, and program names all differ. In California, it's called Medi-Cal. In Texas, it's Medicaid. In New York, it operates differently than most states. When we talk about what Medicaid covers, we're talking about the federal floor, plus whatever your specific state has chosen to add on top. So who qualifies for Medicare? Three main pathways. First, age. If you're 65 or older, and you or your spouse worked and paid Medicare taxes for at least 10 years, you qualify for Medicare Part A with no premium. Second, disability. If you've been receiving SSDI for 24 months, you automatically become eligible for Medicare regardless of your age. Third, specific conditions. People with end-stage renal disease and people with ALS qualify for Medicare immediately, without the 24-month wait. Who qualifies for Medicaid? The rules vary by state, but the main pathways for disabled people are low-income adults meeting state income thresholds under the Affordable Care Act expansion. People receiving SSI automatically qualify for Medicaid in most states. People with disabilities meeting state-specific functional and financial criteria. And people who qualify through Medicaid waiver programs, which we'll get to.
Medicare is divided into four parts: A, B, C, and D. Part A is hospital insurance. It covers inpatient hospital care, skilled nursing facility care following a qualifying hospital stay, hospice care, and some home health care. For most people who've worked and paid Medicare taxes, Part A has no monthly premium, but it does have a deductible of $1,636 per benefit period in 2026. Not per year, per benefit period. Part B is medical insurance. It covers outpatient care, doctor visits, preventive services, lab tests, mental health services, durable medical equipment, and some home health care. Part B has a standard monthly premium of $202.90 per month in 2026 for most people. Part B also has an annual deductible of $283, and after that you generally pay 20% of the Medicare-approved cost. Part C is Medicare Advantage. This is an alternative way to receive your Medicare benefits through a private insurance company that contracts with Medicare. Medicare Advantage plans must cover everything original Medicare covers, and most include Part D prescription drug coverage. They often include additional benefits like dental, vision, hearing, and fitness programs. The trade-off: you typically have a network of providers you must use, and the plan's rules and costs vary significantly. As of 2025, more than half of Medicare enrollees are in a Medicare Advantage plan. Medicare Advantage versus original Medicare is one of the most significant decisions a Medicare enrollee makes. The key thing to understand: Medicare Advantage plans change every year. Benefits change, networks change, drug formularies change. Reviewing your plan during open enrollment, October 15th through December 7th each year, is not optional. Part D is prescription drug coverage. Each plan has a formulary that determines how much you pay for each medication. Starting in 2025, out-of-pocket drug costs under Medicare Part D are capped: $2,000 in 2025 and $2,100 in 2026. For people on expensive specialty medications, this is a significant change under the Inflation Reduction Act. Medigap, also called Medicare Supplement Insurance, is a separate private policy that helps cover costs original Medicare doesn't pay. Medigap plans are standardized by letter, so Plan G benefits are identical regardless of which insurer sells it. The variable is price. Medigap is only available to people on original Medicare, not Medicare Advantage. What it does is make your healthcare costs more predictable.
Medicaid covers things that Medicare never will.
And for many disabled people, those are exactly the services that make the difference between living independently at home and living in an institution. Every state Medicaid program must cover a core set of mandatory services: inpatient hospital care, outpatient hospital services, physician services, EPSDT services for children, laboratory and X-ray services, nursing facility care, and home health services for people entitled to skilled nursing facility care. States can and do cover much more than this. On top of the mandatory floor, most states cover prescription drugs, dental care, vision care, physical therapy, occupational therapy, and personal care services. Some states cover more, some cover less. This is why your specific state matters enormously. Home and community-based services waivers, also called HCBS waivers, allow states to provide long-term services and supports to people with disabilities who would otherwise require institutional care. These waivers can cover personal care attendant services, supported employment, day programs, home modifications, transportation, assistive technology, and respite care. They are the mechanism that allows many disabled people to live in the community rather than in nursing facilities. The catch with HCBS waivers: most states have wait lists. In some states, those wait lists are years long. If you or a family member needs these services, getting on the wait list now, before you reach the point of crisis, is critically important. In many states, you can be on the wait list even before you're enrolled in the waiver. In 1999, the Supreme Court ruled in Olmstead v. LC that unjustified institutionalization of people with disabilities constitutes discrimination under the ADA. States are legally required to provide community-based services when appropriate placement is available. This is the legal foundation underlying HCBS waiver programs.
You can be on both Medicare and Medicaid at the same time. People in this situation are called dual eligibles. As of 2024, there are approximately 12.5 million dual eligible beneficiaries in the United States. When you're dual eligible, Medicaid acts as a wraparound program that fills in many of the gaps Medicare leaves. Medicaid can pay Medicare premiums, including the Part B premium, as well as Medicare deductibles and co-payments. Medicaid also covers long-term services and supports that Medicare doesn't cover at all, like personal care attendant services
and nursing facility care beyond Medicare's limited skilled nursing benefit. If you're on Medicare but your income is limited, you may qualify for a Medicare savings program. These are Medicaid-funded programs that help pay Medicare costs. The Qualified Medicare Beneficiary Program, QMB, pays Part A and Part B premiums, deductibles, and coinsurance. The Specified Low-Income Medicare Beneficiary Program, SLMB, pays the Part B premium. The Qualifying Individual Program, QI, also helps with Part B premiums. Many eligible people never apply because they don't know it exists. Extra Help, also called the Low Income Subsidy, is a federal program that helps people with limited income pay Part D prescription drug costs. Enrollment in a Medicare savings program automatically qualifies you for Extra Help. In 2025, the benchmark for full Extra Help is an individual income below approximately $23,940 per year. If you're near that threshold and paying full price for medications, this is worth investigating immediately.
Medicare enrollment has specific windows and real financial penalties for missing them. The system is not well designed to alert you before you're already in trouble. For people turning 65, the initial enrollment period is a 7-month window. 3 months before the month you turn 65, the month of your birthday, and 3 months after. The practical advice: don't wait until your birthday. Start the process in the 3 months before. For people on SSDI, Medicare enrollment is automatic after your 24th month of disability benefits. You don't have to apply. You'll receive your Medicare card in the mail. If you have ALS or end-stage renal disease, the wait is waived and Medicare starts immediately. The Part B late enrollment penalty. If you don't sign up for Part B when you're first eligible, and you don't have qualifying other coverage, you'll pay a penalty of 10% on the Part B premium for every 12-month period you were eligible but didn't enroll. And this penalty is permanent. 2 years late means a 20% increase on your premium forever. Part D has its own late enrollment penalty. If you go without creditable prescription drug coverage for more than 63 days after your initial enrollment period, you'll pay a 1% per month penalty on the national base beneficiary premium for every month without coverage. Like Part B, this is permanent. Enroll in the lowest cost Part D plan available when you're first eligible. It's cheap insurance against a permanent penalty. Annual open enrollment for Medicare runs from October 15th through December 7th. During this window, you can switch plans, join or drop Part D, or move between original Medicare and Medicare Advantage. Changes take effect January 1st. Review your coverage every year. Plans change every year. Here's the honest summary. Medicare is federal health insurance that you earn through work or qualify for through disability. It covers the medical stuff, but has significant gaps in long-term care and home services. Medicaid is a needs-based program that varies by state, covers a broader range of services including long-term care, and for many disabled people is the program that makes independent living actually possible. If you're on SSDI, Medicare is coming. Mark your 24th month on the calendar and plan for it. If your income is limited, check Medicaid eligibility in your state, regardless of what else you're enrolled in. If you're dual eligible, understand that Medicaid wraps around Medicare and can dramatically reduce what you pay out of pocket. And if you're approaching a Medicare enrollment window, don't be late. The penalties are real and they're permanent. We've now covered SSDI versus SSI, the application process, SSDI and work, your rights at the doctor's office, caregiver support, assistive tech, and now Medicare and Medicaid. If you've been watching from the beginning, thank you. If this is your first episode, welcome. Go back and check the full library at disability.co. We'll see you next episode.